pain-free movement specialist curriculum, along with my Director of Education, Kevin Murray. I want to thank all of you for having watched the first Understanding Pain video. Hope you got a lot out of it. There's more to come. Today I am with Duran Johnson, one of our pain-free movement specialists here at Function First, and Duran is going to help me out with a little demonstration that we want to share with you. We're going to show you kind of a mini sequence that we use that directly affects some of the posture or some of the pelvic distortions that we frequently see. Now, of course, this all has to start with an assessment, but these three exercises that we're about to show you done in a sequence can have a profound effect on impacting the nervous system, kind of the joint alignment through some of the muscle energy that's used by the individual in this quasi-isometric environment that these exercises are performed on. So I'm going to have Duran get down on the floor right now and share with you some of the exercises that we do. So again, these are done in a sequence. The first one, we're just going to run through them relatively quickly, is our adductor squeezes, where we take this roughly 6-inch pillow. You can use a ball. He's going to put it between his knees. 60 to 70%, he's going to squeeze and release. His palms are up, he's nice and relaxed there. He's going to go through a nice, deliberate, not super fast, not super slow contractions of squeezing the pillow. After that, we're going to exchange the pillow out for this non-elastic strap. And he's going to tie this, strap this around his thighs just above his knees. It's going to, in most cases, we have the knees a little bit more narrow than the feet, but that is actually modifiable, again, depending on what's going on with the client after we've assessed them. But what he's going to do here, he's going to press out and release using the opposing muscle groups. This is a non-elastic belt, which again transfers some of the force into the sacroiliac area and also some of the motion at the hip joint, besides just using these adductor muscle group. Now, finally, after that, the third exercise is going to be the frog. And similar to a yoga exercise, Duran's going to bring his feet together. He's going to let his knees just drop out to the side. He's completely relaxed here. He's not forcing his knees down, nor is he resisting them down. This is going to have an impact on the adductor complex, as well as what the tension does in its attachments on the pelvis, creating a pitch or an anterior tilt to the pelvis while he's on the floor. He'll bring his knees back together after the allotted time, roughly 30 seconds to a minute, again, depending what's going on. And then he'd run through that same sequence again. 2 to 3 times we'll run through that entire series there. So we know that this neural input from these novel exercises, as well as the reduced threat that's associated with a position like this with the exercises, can have a very influential effect on how the client feels, how their readiness for exercise, and mechanically what it does to the pelvic alignment. The pelvis being the mechanical center of the body, we want to address that. We want to clear the pelvis for what we're doing. So obviously, once you're comfortable with the pelvic assessment process, you can see where this fits into your program. Because programming is one of the #1 questions that we get. And if I go through this curriculum with Function First on the pain-free movement specialist, am I going to learn how to program? Because we know programming is not a linear aspect. Whether it's for corrective exercise, it's not if this, then that. We can't look at the human body that way. Sprinkling on top of that somebody in chronic pain, and your decision-making tree has to be much more open to addressing the needs and meeting the client and where they are, along with that biomechanical aspect that we're seeing. So we would love for you guys to continue to share your comments and your feedback on both the Understanding Pain video as well as this, and we look forward to working with you guys more again in the future. Thank you.